Hi everyone, today I am giving you information on the topic aphakia. So let's move to its definition. Aphakia literally means the absence of crystalline lens. Okay, so let's see. Here is the eyeball, and this one is the cornea. Okay, this is the iris, and here the colored part is the iris. Okay, the central area is the pupil, which is shown here the darker. Okay, and here the pupil is shown, which is a black in color. Behind the pupil there is a crystalline lens. The whitish area which you can see is the crystalline lens. Okay, so in case of aphakia there is an absence of crystalline lens. This lens will not be present here. Okay, then we will shine a torch inside the eyeball, then we will find out that there is no crystalline lens. Okay, otherwise it will shine, but it will not shine in case of aphakia. However, from the optical point of view, it may be considered as a condition on which the lens is absent from the pupillary area. Okay, this one is the pupillary area, and we will find out by shine a torch inside the eye that there is an absence of crystalline lens inside the eye. Okay, so this condition is known as aphakia, in which there is an absence of crystalline lens. Next one, causes. So let's move to its causes. First one is the congenital absence of the lens. There is an absence of crystalline lens in the eye of the human by birth. Okay, at the time of the birth, there is no presence of the crystalline lens inside the human eye. Okay, and it is a very rare condition. Next one, surgical aphakia. During surgery, removal of the lens takes place, and it is called surgical aphakia. While doing the surgery, some complication get takes place, due to which we will remove the lens from the eye of the patient. While doing the cataract surgery, we will remove the cataractus lens from the eye of the patient. Okay, that is known as surgical aphakia. So in case of surgical aphakia, if we will shine a torch inside the patient eye, then the pupil will becomes black in color. Okay, no reflection will be seen in the eye of the human. Okay, let's move to the next one is the traumatic extrusion. When any heavy object harm our eyes in that way, in which sometimes the crystalline lens needs to be removed, or sometimes it comes out, but it is a very rare condition. Okay, next one is the posterior dislocation. Okay, in vitreous the lens get dislocated from its actual place and cause the optical aphakia. Okay, so let's see. This is an eye, and if you can notice that the whitish area is the lens. Okay, and it gets dislocates, it will move to the upwards. If you can see here that this is the position of the lens in case of this eye. Okay, but the normal position of the lens is here. These are the muscles which will hold the lens, and the normal position of the lens is here. Now it will get dislocated. This is known as posterior dislocation of the lens. Okay, next one, optics of aphakic eye. Now the eye becomes highly hypermetropic. Hypermetropic means a lot of the plus value will be accepted by the eye. In between, roughly we can say plus 10 to plus 12. Okay, next one, power of the crystalline lens get reduced from the 60 diopters to 45 diopters. Okay, so the crystalline lens which is present in the eye, that lens have some value which we are supposed to provide the patient from the outside. So the all machines will show plus power, so they will show that the patient is hypermetropic. Next one, there should be total loss of accommodation, because there is no crystalline lens which focus at the point when the ciliary muscles and the zonular fibers contract and relax. As we all know that this one is the crystalline lens which is holded by the ciliary muscles as well as the zonular fibers, which will contract as well as relax continuously so that we will focus on any image. Okay, so when there is a removal of crystalline lens, so no work done by the zonular fibers or the ciliary muscles, due to which there should be a total loss of accommodation because of the absence of the lens. Okay, next one, clinical features. In case of clinical features, we will discuss about the symptoms as well as the signs. First one is the symptoms. First symptoms is defective vision. Next one is the erythropsia and cyanopsia. Okay, defective vision. There is a defective vision for both far and near due to high hypermetropia. in which there is a person is unable to see near objects clearly due to the total loss of accommodation. Okay, there should be a defective vision, means a very blur vision for near as well as far. The patient is not be able to see the near as well as not be able to see the far, okay, clearly, because there should be a total loss of accommodation. Next one is erythropsia and synopsia. Okay, in this condition the red and blue images are seen by the human being which is suffering from the aphakia. This occurs due to excession entry of the ultraviolet and infrared radiations in the absence of crystalline lens. Now in the eye there is no presence of crystalline lens which will control the light and which will focus the image on the retina. So directly the image will focus on the retina without any clarification or without any selective things. So the image will be seen blue as well as the green due to a lot of infrared radiations get enter inside our eye. Okay, so these are the symptoms. It should be a defective vision as well as erythropsia and synopsia. These red and blue images are seen. Okay, the image should be seen like this to the patient because there is a plus 10 to 12 power and the patient is high hypermetropic due to the aphakia. We have removed the crystalline lens from the eye of the patient. Next one, signs. Now, limbal scar may be seen in the surgical aphakia. Okay, so here is the limbus area. Okay, the limbus area is present here. So limbal scar may be seen at its border. Okay, simply a small scar should be present at anywhere in case of aphakia. Next one, AR readings will show hypermetropia. Autorefractometer's reading will always show the high plus power in between 10 to 12 or 10 to 15. Retinoscope will show high hypermetropia. If we will do the retino, then it will again show the high plus power. Pupil will jet black in color. Now if you can notice the pupil here, it is black in color. It is purely black. Okay. Next one, iridodonosis means tremulness of iris can be demonstrated. Okay, iris may be in a trembling condition because there is no support of the crystalline lens behind it. Fundus examination show hypermetropic small disc. If we will see the fundus with the IO indirect ophthalmoscope, then it will show the small hypermetropic disc. These are the signs. Okay, let's move to the next. Now what is the treatment? Optical principle is to correct the error by convex lens of appropriate power so that an image can be formed of the retina. Okay, we will use the plus power to correct the aphakia or to correct the hypermetropia. Okay, modalities of correcting aphakia. Now we have some options. First one is the spectacle, second one is the contact lens, third one is the intraocular lens, fourth one is the refractive corneal surgery. Let's see one by one. First one is the spectacle. Spectacle prescription is the most common method in correcting aphakia in the developing countries. Okay, roughly about plus 10 diopter with the cylindrical lenses. The cylindrical power is given with the plus 10 power is given to the patient. Okay, and in addition plus 10 power is for only distance. The person can see the distance easily, and in addition when the person is supposed to see the near, then plus 3 diopters to plus 4 diopters should be given to the patient in spectacles. Okay, so this is the commonest method. Okay, thick glasses should be given to the patient of plus 10 bar. It is more than plus 10 bar. For the example these are shown. Okay, next one, disadvantages of spectacle. The image get magnified by 30%. Okay, the size of the every image is magnified by the 30% according to its actual image. Next one, not useful in unilateral aphakia. When there is aphakia in the patient only one eye, then only one eye is aphakic, then it is not useful. Okay, so binocular balancing will not be seen in case of the patient. The person will feel diplopia, so it is not useful in case of unilateral aphakia. Thick lenses, we are supposed to give the thick lenses to the patient, and it is very difficult if the person is old age. Field of vision is limited. Okay, now field of vision means if we are wearing the spectacle, then the side area will not give a proper vision. Okay, so the field of vision will get reduced. Next one, prismatic effect of the thick lenses. Thick lenses will give the prismatic effect. These are the disadvantages of the spectacles, okay, when they are given to the aphakic patient. Next one are the contact lenses. Now the second option we have contact lenses. In this case, less magnification of image over the spectacles. In case of spectacles, 30% image will be magnified, okay. So here the less magnification is seen. Next one, no prismatic effect. There are no thick glasses, wider and better field of vision. In case of spectacle, if we will wear the spectacle, then when we are supposed to see the outside the glass, then we are supposed to see, we will find out that it is a blur vision. But in case of contact lenses, as they are in contact with the cornea, so they will give the wider as well as better field of vision. Next one, cosmetically they are more acceptable, better suited for the uniocular aphakia. If a person have one eye aphakia, then these are better suitable for that person, okay. Next one, these are the contact lenses, okay. We will make the contact lenses of the appropriate power, and then we can use it. We can also use the simple contact lenses, as well as we can also use the colored or the tinted contact lenses. Disadvantages of contact lenses: these are more costlier than the spectacles, okay. Cumbersome cumbersome to wear, especially in the old age as well as childhood. In case of childhood, we are not supposed to wear, it becomes difficult for a person to wear, as well as in case of old age, again it is a trouble to put the contact lenses as well as to remove the contact lenses. Next one, corneal complications may be associated, because when we use the contact lenses, then not proper oxygen should be passed to the cornea. Sometimes redness, watering takes place to the cornea, and proper hygiene should be maintained, which is not possible in case of old age patients as well as in case of childhood, okay. Next one, intraocular lens implantation. It is the best method which is available for the aphakia. Therefore, it is the commonest modality being employed nowadays. Primary IOL implantation is done during cataract surgery, okay. Secondary IOL is done already in the aphakic patient. We will primary IOL implantation is done during the cataract surgery, but sometimes while doing the cataract surgery, some complication takes place, due to which we will remove the cataractous lens and will not put the another lens, okay. So secondary IOL is done. In case of secondary IOL, we will use the SF IOL, or sometimes we will use the iris claw lens in the aphakic patients, okay. Next one, cataract surgery. Now in case of cataract surgery, the clouded lens should be removed from the eye as it is shown, and the new IOL can be implanted inside the eye of a patient, okay. Next one, refractive corneal surgery, okay. So corneal surgery we will also can do if there is no option for the implantation of contact lens, then we will do the hyperopic LASIK, okay. It may be tried in those cases where the secondary IOL cannot be implanted, okay. When all the options are closed, then we will do the hyperopic LASIK. Hyperopic LASIK is done on the cornea, okay. It is a corneal treatment and done on the cornea to remove the power of the glasses, or to reduce the power of the glasses. This was the end. Thanks for your patience listening.